We're a long way from
My name's Joseph Summers, and I come out here. It's about 11 o'clock last night. There was close to 1,000 people here already.
What time is it right now?
I say it's probably about 4:30. It's hard to get insurance these days. It's hard to afford it. I've got 3 kids and a wife, and it's just hard to afford it.
Good morning, everybody. Good morning. Okay, welcome aboard again. I'm sure many of you have been here before, and we're happy to see you again. Now we are going to start calling the numbers. Who's got number 1? Come on down. Number 2. Number 3. Show us your numbers, please.
Show me your numbers.
Number 4. Number 5. Number 6.
I founded Remote Area Medical in 1985, specifically with the idea of taking healthcare to overseas territories. However, in the course of events, people started asking us if we couldn't bring some medical relief to one of the poorer counties in the nation. One thing led to another, and so now 64% of everything we do is right here in the United States.
Why do you think there's so many more people this year?
Because health care is really bad. They can't get it anywhere.
Do you have health care?
Very little. It didn't cover 90% of the stuff that I need done here today. I can go to the doctor twice in a whole year, and I have diabetes.
My name's Tim Church. Got here at right around 3:30 this morning. Ticket number 1361.
29. 30. 31.
You don't think you're going to make it inside today?
Not the way they're going, no. Right now, if it wasn't for my cane and this post, that's the only thing keeping me up right now.
Okay, up to 34. 35.
And this is sad in America that this is going on. Most insurances will not pick me up because I have too much wrong with me already.
36. 37. 38. 39. Number 4.
For 20 years, I was an insurance industry executive. I spent the last 15 years as head of corporate communications at Cigna. But 2 years ago marked a big turning point in my life when I came to the 8th annual Ram expedition here in Wise County. This is the 10th time they've done it. And when I walked through the fairground gates and I saw the need that was here, hundreds and hundreds of people lined up to get care, many of them to get care in animal stalls, I knew then that what I was doing for a living was not what I felt I should be doing.
We lost our insurance back in May.
What happened?
The economy. Things just went slow, and they couldn't afford to help pay for our insurance.
Every year it's been growing. I'm seeing people who are underinsured more than ever. The volunteers were saying that they were expecting 20% more people needing care this year. It just points up the need for really comprehensive health care reform.
A lot of the insurance policies that are available are too expensive for people that have minimum wage jobs. They can't truly afford those on their own. I've tried that. You can't afford them, especially when you have, there's 4 people in your family.
My arms, they sort of go numb up through here and have a tingling, burning feeling, and my fingers want to draw in. Being a single mom, I've looked into getting insurance, but the time you pay your monthly bills, I can't afford it.
I used to drive a coal truck off-road for Dale Presley, and then they offered insurance there, and then I lost my job. And then the insurance left, and I went and tried to see a doctor, but none of them see you if you don't have the cash, and it's $120 a visit. So this place right here is really great. Once a year, it needs to be more than once a year. Where I'm having prostate problems and I don't have insurance, I can't see a doctor. And
do you get medication?
No, I just suffer. And I know what I'm going through. I know there's people that's got it worse than I do.
He has type 1 diabetes.
Okay. I could purchase an insurance, but I would be on a pre-existing condition.
Well, one thing that we can do
is that we can change your pump settings just to give you a little bit more insulin. He was a really good example of a patient who, without access to regular medical care, can develop some of the more serious complications of diabetes. And in his case, both his eyes and kidneys have already been damaged. We have such good ways of treating diabetes now that if he had had access to medication and regular contact with physician, it's likely those would have been prevented. All of us who come here are, I think, very grateful for the opportunity to really feel like we're helping people. But on the other hand, we really look for the day where we don't have to do this anymore.
I seriously doubt that we'll be out of a job anytime soon. I would like to think that we could be. It'll depend on what kind of legislation comes out of this national debate, and hopefully one that will include dental care and vision care for the masses of people that don't have access to it at an affordable price. And if it doesn't, well, a year from now, 2 years from now, we'll still be at Wise County and all these other places that we go to again.
98, 99, 100. Only 1,500 more to go.